Chloroquine. Chloroquine is a 4-amino quinoline. Chloroquine is a 4-amino quinoline. It is very effective and rapidly acting blood scintocyte against Plasmodium vivax ovale malaria. Chloroquine is a 4-amino quinoline. It is very effective and rapidly acting blood scintocyte against Plasmodium vivax ovale and malaria. Chloroquine sensitive strains of Plasmodium falciparum, vivax ovale and malaria, and chloroquine sensitive strains of Plasmodium falciparum. It is a very effective and rapidly acting blood scintocyte. It is a blood scintocyte. It belongs to the class 4-aminoquinoline, and also Plasmodium knowlesi. It has no activity against the liver forms. Liver forms के लिए it has no activity, like pre-erythrocytic state and hypnozoites के लिए it has no activity. It is a blood scintocyte, very effective and rapidly acting blood scintocyte. No activity against the liver forms, that is pre-erythrocytic and hypnozoites. Mechanism of action of chloroquine. Chloroquine is a basic drug which is taken up by the acidic food vacuoles of susceptible plasmodia and inhibits the conversion of heme to hemozoin. So chloroquine is a basic drug which is taken up by the acidic food vacuoles of susceptible plasmodium. Basic drug taken up by the acidic food vacuole of the susceptible plasmodia and inhibits the conversion to heme to hemozoin. इसके कारण heme to hemozoin का जो conversion है that is inhibited. The drug heme complex is toxic. ड्रग और हीम का जो कॉम्प्लेक्स है दैट इज टॉक्सिक and kills the parasite. Resistance to chloroquine is common with Plasmodium falciparum. देखो प्लाज्मोडियम के एसिडिक फूड वैक्यूल में क्या होता है, हीमोग्लोबिन इज कन्वर्टेड टू हीम, हीम इज कन्वर्टेड टू हीमोजॉइन. ये जो हीम है ये टॉक्सिक होता है, हीमोजॉइन नॉन टॉक्सिक होता है. क्लोरोक्विन जो कि एक वीक बेस है, इट गेट्स कंसनट्रेटेड इन द एसिडिक वैक्यूल ऑफ पैरासाइट. इट बाइंड्स टू द टॉक्सिक हीम. ड्रग और हीम का जो कॉम्प्लेक्स है इट प्रिवेंट्स द फॉर्मेशन ऑफ हीमोजॉइन, damages plasmodium membrane. Chloroquine is a weak base. It will get concentrated in the acidic vacuole of parasite, binds to heme, forms drug-heme complex, and damages the plasmodial membrane. Pharmacokinetics. Chloroquine is commonly administered by oral route. It is well absorbed after oral and parenteral administration. Commonly by oral route, and it is well absorbed after both oral and parenteral administration. It has strong affinity for melanin containing tissues. Chloroquine has strong affinity for melanin containing tissues. It gets rapidly distributed to tissues, that is extensive tissue binding. It gets rapidly distributed to tissues. Therefore, to achieve an effective therapeutic plasma concentration, a loading dose is used during treatment of malaria. It gets concentrated in liver, spleen, kidney, lungs, and skin. Chloroquine is metabolized in liver and excreted in urine. Chloroquine is commonly administered after oral route is commonly administered by oral route. It is well absorbed after oral and parenteral administration. It has a strong affinity for melanin containing tissues. It shows extensive tissue binding. It gets rapidly distributed to tissues, that is extensive tissue binding. Therefore, to achieve an effective therapeutic plasma concentration, a loading dose is used during the treatment of malaria. Because it has extensive tissue binding, a loading dose has to be used. It gets concentrated into liver, spleen, lung, kidney, and skin. It is metabolized in liver and slowly excreted in urine. Adverse effect: chloroquine in anti-malarial doses may cause nausea, vomiting, skin rashes, itching, headache, and visual disturbances. Nausea, vomiting, skin rashes, itching, headache, and visual disturbances. Nausea, vomiting, headache, skin rashes, itching, and visual disturbances. Parenteral administration can cause hypotension, confusion, cardiac arrhythmias, convulsion, and even cardiac arrest. Parenteral route के कारण hypotension, confusion, cardiac arrhythmias, convulsions और cardiac arrest भी हो सकता है. Hypotension, confusion, cardiac arrest, convulsions, and cardiac arrest. Prolonged administration in large doses, as in rheumatoid arthritis, may cause irreversible retinopathy and ototoxicity. It can also cause myopathy, cardiomyopathy, neuropathy, and rarely psychiatric disturbances. Long term therapy requires ophthalmological examination once in 3 to 6 months. It should be avoided in people with epilepsy. It should not be given with mefloquine. It is safe for use during pregnancy. It should not be given with mefloquine as it can precipitate seizures. Okay. Chloroquine can cause nausea, vomiting, skin rash, itching, headache, visual disturbances. Nausea, vomiting, skin rash, itching, headache, and visual disturbances. Parenteral administration के कारण hypotension, cardiac arrest, confusion, convulsion, cardiac arrhythmias can be there. या prolonged use के कारण there can be irreversible retinopathy and ototoxicity. Prolonged use के कारण irreversible ototoxicity and retinopathy. It can also cause myopathy, cardiomyopathy, neuropathy, and psychiatric disturbances. Prolonged use के कारण irreversible ototoxicity और retinopathy हो सकता है. It can also cause myopathy, cardiomyopathy, neuropathy, and psychiatric disturbances. Should be avoided in patients with epilepsy. Uses. पहला use है मलेरिया. Chloroquine is the drug of choice for the treatment of acute attack of malaria caused by Plasmodium vivax ovale malaria, chloroquine sensitive Plasmodium falciparum, and Plasmodium knowlesi. Fever resolves within 24 to 48 hours. Blood smear becomes negative within 2 to 3 days. Okay. तो acute attack of malaria के लिए it is the drug of choice. Acute attack of malaria caused by vivax ovale malariae falciparum and knowlesi. Chloroquine sensitive Plasmodium falciparum. For malaria due to Plasmodium vivax and Plasmodium ovale, primaquine is also administered in addition to chloroquine for radical cure. तो वाइवैक्स और ओवल के रेडिकल क्योर के लिए प्राइमाक्वीन इज एडमिनिस्टर्ड इन एडिशन टू क्लोरोक्वीन. रेडिकल क्योर ऑफ वाइवैक्स एंड ओवल के लिए प्राइमाक्वीन इज गिवन अलॉन्ग विथ क्लोरोक्वीन. Chloroquine is very effective chemoprophylactic agent for all types of malaria except that caused for the resistant strains of Plasmodium falciparum. Very effective chemoprophylactic agent for all types of malaria except those caused by the resistant strains of Plasmodium falciparum. Other uses में amoebiasis. Hepatic as it is highly concentrated in liver. Lepra reaction, anti-inflammatory effect is useful. Rheumatoid arthritis because it scavenges free radical and stabilizes the lysosomal membrane. Chloroquine scavenges the free radicals and stabilizes the lysosomal membrane in rheumatoid arthritis. Infectious mononucleasis and autoimmune disorder, that is discoid lupus erythematosus. So the mnemonic is malaria for the use of chloroquine. M for malaria, A for amoebiasis, L for lepra reaction, A for nothing. Then R for rheumatoid arthritis, I for infectious mononucleasis, and A for autoimmune disorder, that is discoid lupus erythematosus. Malaria, amoebiasis, lepra reaction, rheumatoid arthritis, infectious mononucleosis, and autoimmune disorder, discoid lupus erythematosus. Tablet chloroquine phosphate 500 mg is equal to 300 mg chloroquine base. Tablet chloroquine phosphate 500 mg is equal to 300 mg chloroquine base, and tablet chloroquine phosphate 250 mg is equal to 150 mg chloroquine base.